There we go, right. Evening, everyone. It is 6 o'clock, so I'm going to bring the meeting to order, and I would like to welcome everyone to the Housing, Health and Environment Overview and Scrutiny panel. Item number 1 on the agenda is the evacuation procedure. A fire drill is not expected, so if the alarm sounds, please evacuate the building quickly and calmly. Please use the stairs and do not use the lifts. Once out of the building, please gather outside Lloyd's Bank on the opposite side of the road. Exit by the door which you entered the room or by the fire exits, which are clearly indicated by the standard green fire exit signs. If you need any assistance in evacuating the building, please make yourself known to a member of staff. Could I ask that all mobile phones are turned off or set to silent? And I would also remind everyone here that this meeting is being filmed and will be uploaded onto the Council's YouTube page at some point tomorrow. Item number 2 is to receive apologies for absence. I've received apologies from Councillor Cape. Are there any other apologies to declare? Councillor Gutteridge.
Thank you, Chair. Tony Cooper.
Any further apologies? So if those two can be noted in the minutes. Item number 3 is to confirm the minutes of the meetings that were held on the 29th of June 2023 and the 5th of October 2023. Having read through both of those minutes, I'm happy that they are true and accurate. Do they receive a seconder? Seconded by Councillor Harbison. Are there any members who wish to speak to the minutes? No. So can I see all those in favour of adopting both sets of minutes, please show. Against? Okay, that's unanimous. Thank you. Item number 4 is declarations of interest. Are there any declarations that members would like to declare? I have one declaration that I need to make, which I haven't yet updated in my register, but will do in due course. I attended the Commonwealth Local Government Forum in Kigali, Rwanda last week. This was not paid for by the Council or by any other authority related to it. And I will declare that to my register accordingly. Item number 5, public consultation. I've been made aware of one member of the public who wishes to speak tonight, and that is Mr. Peter Smith, and that is on item 9. Is that correct, Mr. Smith? Thank you. So question number 6 is questions to Cabinet. We've got Councillor Claire Golby, who's Deputy Leader of the Council and Cabinet Member for Housing, and Councillor Gutteridge as Cabinet Member for Environment and Health present to answer questions from the panel. So if I can kick off as Chair, Councillor Golby, it was widely reported in February following our budget process that as part of the housing revenue account we had to make amendments to our charges with respect to garages in the HRA account, and I just wondered, is retention in garages an issue to the housing department, and what is the demand? Has that demand reduced since the amendments to the charges?
I'll give you actually a broad overview in that, so it provides a bit of context to the background as well as the yes/no, because it's not necessarily a binary answer. So there was a question raised, I believe at Cabinet it was, about terminations of how many people have handed keys back effectively. How has the increase in charges affected the retention, like you say? So we've got 135 terminations since April, and juxtapose that against the fact that we have 319 applicants on the waiting list, it's actually quite positive. 205 of those tenants are private tenants, so will pay the top rate should we give them a tenancy in the garage. And we've also recently carried out a waiting list review And all of those applicants still want to rent a garage off us. So again, that is a real positive. So we're working through the list and we're going to allocate the garages that we've got accordingly. But in total, we've got 1,300 garages there or thereabouts. We've got 640 that are currently void, 709 that are occupied, and we're working through the applications, as I've said, for any that we've got that we can fill. So the increase in charges hasn't actually really adversely affected what we're doing. In fact, quite the opposite. The increase in charges has actually seen that we've gone from a weekly charge rate for garages round about £7,500, and it's now consistently between £11,500 and £12,500 per week. So we're looking at around an increase of just short of £4,000 per week based on the numbers, and that is from the point of when we increased the charges. So I hope that provides a bit of context and clarity.
So any commentary that we've lost money as a result of these changes, that is clearly not the case.
Absolutely. Any claims made to that effect are totally false and completely demonstrably false also.
Are there any further questions to Cabinet? Councillor Kandaka?
Thank you very much. Can I start with a couple of questions to Councillor Guttridge? The first one I sort of gave a bit of pre-warning to him. I was interested in flooding in Whittleford Park, where there's potential to have a flood scheme. I know several of his officers went to the stakeholder event a year ago. So I just wanted to ask Councillor Guttridge's views on what we know about existing flooding in the park over the last, like there's a big rainfall event a month ago, and if the officers have briefed him on the possibilities of having some flood schemes to keep the floodwater in the park rather than let it go into the industrial estate or onto Queen Elizabeth Road. Thank
Councillor
you,
Guttridge?
Thank you, Councillor Kandaka. I think you've preempted yourself because I believe you've got it on item 13 of this agenda for the work programme for the flood alleviation. So I'll leave it till item 13.
Councillor Kandaka?
Thank you, Chair. The reason I ask now is we're not supposed to ask Cabinet members questions necessarily later on, but if Councillor Guttridge is staying, that would be great. My second question was about Bermuda Physical Activity Centre, which is being built on Miners Welfare Park. I believe that's got the go-ahead effectively almost now, bar sorting out planning. But what I wanted to check was, were plans being progressed to plant new trees for the ones that we lost? Because obviously the first thing we need to do is remove trees to allow the centre to be built. And the second thing was, is there any progress on the timescales for the new skate park? Thank you.
Thank you, Councillor Kandaka. I think I just have to start with that I think Bermuda is in Nuneaton and Bedworth is in Bedworth. And I think the project you're on about is in Bedworth, the physical activity hub. Is that correct? Thank you. Bermuda is Councillor Golby's. Yes, we will be removing some trees, unfortunately, but we will be planting more than we are taking out eventually. We are looking at that. We might start to look to take the trees out early part of next year before bird nesting season, if we're going to take them out. Going on to the skate park, yes, the skate park is progressing nicely, and that will be all intertwined with the physical activity hub in Bedworth.
Councillor Kandaka?
The third area I wanted to just ask you about was the adoption of outdoor areas on the new estates in Wellington. I believe Matt Crosby and his team keep working with developers, but we seem to get very little progress on those adoptions of the open spaces by the Borough Council. So I wanted to just check we had the capacity in the team to be progressing those, and if there's any news. Thank you.
Councillor Guttridge?
Thank you, Councillor Kandaka. Yes, we are progressing. If you'd like to put your full question on customer services, we can get one of our officers to come back with notification, and I do have capacity to do the snagging lists and looking at various sites across the borough.
Councillor Kandaka?
Thank you. I've now got two questions for Councillor Golby. The first one is about people presenting as homeless, because obviously it's an ongoing battle this council has to obviously keep housing these people. So I was hoping we could have a quick update on how the process is going in terms of our temporary accommodation and what the size of people, the effective numbers of families we've got currently being housed in our accommodation and bed and breakfasts. Thank you.
Is that something that you'd be able to
If-
reply
if-
to, Councillor Golby?
Yeah, if you give me 2 minutes.
Sure. And perhaps is your second question related to the same subject?
No, my second question was just related to the empty garages. If we've got
Right.
over 640 empty, I wondered what the hold-up has been in refilling them and if we're doing any refurbishment to make them rentable. Thank you.
I can answer the garage one off the top of my head. I mean, that has been well documented, that we're actually reviewing what we've got to see what we need to refurbish, what we need to demolish and what we can use for other things. That has been said time and time again. Yeah. We are under the process of doing a capital projects review and we are reviewing our estate. So, which again has been mentioned time and time again. It's all part of the overall housing review that's currently taking place, which I believe you asked me for an end date for last time I was here, or was it in Cabinet, and which I said, measure twice, cut once, was my response. So that's, again, I can't really offer you any more on that other than it's an ongoing situation that we're reviewing.
And with respect to the first question, would you prefer to respond more comprehensively under any other business at the end of the meeting? Or?
Yeah, I've got the stats, I just need to pull them up.
Sure. If that's okay with you, Councillor Kandaka, we'll refer back under AOB. Are there any further questions to Cabinet? No. I do have one final one, Councillor Golby, if I may. We've done a lot of work on this committee around antisocial behaviour and the impact that has on the housing revenue account. And I just wondered if there was any data within the council, or perhaps data that's collected nationally, around the correlation between ASB that is reported to us in the housing department and evictions that we are successful in carrying out.
Yeah, actually we were mentioned in a news article not that long ago, and that was off the back of a nationwide, or certainly in England, FOI that was sent out to all councils asking for some information. And the response that we gave back actually pitched us in, basically the FOI was based around how many complaints of ASB do we have within our council housing stock, what were our responses, and how many evictions came off the back of it. And the purpose of the article was to try and see who's dealing with ASB in the strictest manner. And out of 78 councils, and that includes some of the really large councils as well, like Birmingham, we are number 5 in performance nationally for dealing with ASB. So the numbers aren't massive. We've got 414 as of, this is up to June this year, so it's 22-23. We got 414 ASB complaints. We dealt with them in the best way possible, and 7 of those complaints led to a complete eviction of trouble-causing tenants. So, and I hope this actually, so we were 5th in numbers. We were also 5th in per complaint, evictions per complaint as well, and that pitches us again against the same bigger councils like Birmingham and Sandwell. I'm looking down the list that I was sent. Actually, Sandwell got 7,500 complaints and evicted 1 person. We are punching well above our weight, and it's testament to the changes that we've implemented in the Housing and Communities team, and the team are working really well, and I can't thank them for the amount of work they're putting in to make communities better.
Well, that's incredibly good, and if we're top 5, then we are almost certainly leading the national fight against antisocial behaviour and evicting those housing tenants who wish to cause misery to other housing tenants. And it's obviously the extreme small minority, but it's only a small minority that causes absolute hell for other people. And our officers in the housing department should be commended for their work in making us one of the country's leading housing departments in tackling antisocial behaviour. And we will come back to Councillor Kandaka's final question under AOB. But I would like to make progress, if possible, because we've had several minutes already on this item. So item number 7, we have a report on emotional wellbeing and mental health support for children and young people in Warwickshire. And I'm pleased to welcome Helen Bruton, who is the Commissioner for Children and Young People's Mental Health across Warwickshire, Chris Evans, Associate Director for Operations, and Michelle Wood, who is the Transformation Lead for RISE. Helen, would you want to make some comments to the committee or present what you've submitted, and we'll go from there? Thank you.
Thank you. Thanks, Chair. So I think members may remember that last year we attended the committee and provided a report, as was requested, about emotional wellbeing and mental health support and services in Warwickshire specifically. A request was made to provide some information around Nuneaton and Bedworth. I think we struggled a little bit to get all that data together, but I would like to say that this year I think we've provided you with a bit more data, more specific to Nuneaton and Bedworth, where we've been able to, and that's thanks to colleagues from RISE, CWPT. Also, there's a little bit of data in there from some of the other services, which I'll go into as we go along. So in terms of the report, it does set out what is the commissioned services that we have in Warwickshire. There's some service level data in the report, which I'll go through, but also there is a few points that I just want to raise in terms of strategic work that we're doing as well around this area of health. So we, as a system, and when I talk about system, I mean Coventry and Warwickshire, so that footprint of Coventry and Warwickshire, we have something called a CAMS local transformation plan. This is something that's a directive from NHSE that we must have as a footprint, as an ICB footprint of Coventry and Warwickshire. And we produce it every year in October. And we've just published this in October. It's on the ICB website, which is, I've given the link in the report, I think it's in paragraph 5.1.1. That plan sets out a sort of priority, it sort of sets out what we've done over the last year in terms of the work that's been done around emotional wellbeing and mental health. It then also looks forward to what priorities we've got for the following year. And the priorities that we have for the next year are to continue to look at meeting our constitutional targets for mental health that NHSE set for us, which is an access rate of children and people accessing services, and also targets around wait times for eating disorders. We are to continue to develop the full service offer for children and young people to 0 to 25, looking at that age range, particularly around sort of 16 to 25 in particular, where, as you know, or you may know, that the RISE service will end at 18, but obviously then there is a sort of transitions period for young people into adults. We want to looking at data and better collection of data around the system so that we can plan our services in the future. And also there is an emphasis on early intervention prevention services as well within that LTP. So that's, like I say, that's available on that link that I've listed in the report. And then also just to update on a piece of work that we were in the middle of last time that we came to the committee. Warwickshire County Council Public Health team have produced what's called a joint strategic needs assessment around mental health and wellbeing of infants, children and young people for Warwickshire. That was it was being produced around this time last year, but it's now been published. It was published in May. It's a document that sort of sets out some of the key issues around that, the wider things that affect children and young people's mental health, the sort of more wider determinants type of work. And there's some stats and information in there that you might find useful. So I've put the link in the report for that. So in terms of services, so we have a commissioned what is called nationally CAMS service, but in Warwickshire we don't refer to it as CAMS, it's the RISE service. That is commissioned by Warwickshire County Council and the ICB, and is provided by CWPT in partnership with Coventry Warwickshire Mind as well. So it's an umbrella of services. I've listed the services. I won't go into a lot of detail here, but under 4.4 there is a list of the services that RISE encompasses, but it includes things like the specialist services, but then also things like early intervention services like primary mental health team, mental health support teams. There's also the eating disorder service and various others, but they're listed there, so I'll leave that for members to look at in the report. And also my colleagues from CWPT may want to touch on some of those in a moment. So around that, we have other services that we commission. So we have something called COOF. This is an online digital service. Children between the ages of 11 to 25 can log on to a website. They can use the site in various ways. It's anonymous. They don't have to register their name. We do encourage them to register things like their date of birth, so that we can, and also where they live, so that we've got an idea in Warwickshire where we're getting children logging in from. But they don't have to if they don't want to. And the service is a text counselling service, so it's done through text. They can speak to a counsellor, qualified counsellor. There is also articles and information about mental health. There is discussion boards that are moderated so they can discuss issues with their peers. And there's also a daily journal writing facility to help them sort of express themselves around how they're feeling. So it started in March 21, and we started off with really good figures for a couple of years with that. What we are finding, and I have listed in the report around the figures for Nuneaton and Bedworth, is that registrations for the service are starting to slow slightly. And I think we're looking into this, but I think one of the issues is with COOF is promoting it and getting the word out about the service. And it's something that you have to keep doing, because I think people forget that it's there. We are working with their engagement team to keep COOF sort of like out there. And obviously members, it's great if members can promote it. But yeah, and there's lots of information around that service. I've got lots of performance information if members wanted to have more information around that. But there is a lot of good feedback from children and young people with that service, and they do like the anonymity of it. They feel they can express themselves through that service where they might not otherwise do so in other services that might be face-to-face. So we also have something called Peer Mentoring Supports Service, which is provided by Coventry Warwickshire Mind, and this is a pilot programme that's been running a couple of years, due to finish in March. Well, the funding is until March next year. This was commissioned because there was a gap really in services, as I've mentioned, between those ages of sort of between 18 and 25, but it's that gap where children move between children's services and adult services. The project also captures and aims to sort of provide a service for care leavers and also children and young people who may not have even been in any services. And it's based on a peer mentor model. So young people can go in, they can speak to peers who are trained to talk to them about their mental health. And it's essentially that sort of model. But like I say, we've only got that until next year. The other service that I just wanted to sort of note before I pass to Michelle and Chris was mental health support teams, MHST, which you may have heard of. So this is a national scheme. The government have invested quite a lot of money into this. The funding comes down through the ICB. Our provider for the service is CWPT. It's based on a model of providing short interventions for low-level to moderate mental health issues for children in schools. And it's also about helping schools to embed a whole school approach around mental health into the schools, so getting them to talk more about mental health, getting it part of the curriculum, and sort of support around helping the teachers basically support children who might have low-level mental health issues. We've got coverage now across the whole of Warwickshire, so we've got teams in all areas. Nuneaton and Bedworth were part of Wave 5. which probably doesn't mean anything, but that was the wave that they're under, where we received the funding. So that was around January last year, 2022, we got the money for that. So that's being rolled out and is still continued to be rolled out. We have also been awarded another team, so more money, and what we did was to decide to put that extra into Nuneaton and Bedworth again because of the need here. So what we've got is some more money, an extra team, and that's looking specifically at the sixth form cohort of children and young people, so that's 16 to 18 age group. And there is a list there of the schools, and there is some feedback around from Nuneaton and Bedworth schools of who have used the service. So I'll just pause there and just pass over to my colleagues, because I think you might want to say some more about some of the services that you deliver.
Thank you very much, and obviously thank you for inviting us back to talk to you this evening. And I guess that one of the things that I wanted to just open with really is just to reflect the landscape in which that we are currently working, and the challenges that continue to exist for children and young people and their emotional well-being. And certainly we, across our integrated care system, continue to recognise that need. And I think it is positive that there continues to be an investment and a growth in services. And I think that what you are seeing within the report is that continued growth of services. And I think that is something that we are fortunate to be able to see. It is part of a national programme of delivery. And that is because children's mental health and emotional wellbeing remains challenging for them. And I think that we are still at a time where we are sort of dealing with the effects of the pandemic. We will continue to deal with those for some time. And we're also dealing with other social determinants and difficulties, and certainly cost of living and those other challenges that are presenting to children and families are impacting on that lived experience. And in services such as ours, what we also encounter then is the difficulties that creates for them. And I think it's fair to note that those difficulties continue, and therefore the demand on our services has not abated. It has not slowed in terms of the challenges, but actually neither has our resolve to continue to develop the services, to ensure that we are thinking about how to do things in the future that are going to be the right things for children and young people. And that means that we want to continue to try and work with new models of care, and to think about delivering care in the future with new ways that we will continue to work. And the mental health support teams in schools is a particular example. We also continue to take part in Health Education England's programme of improving access to psychological therapies, which means that we are recruiting and training CBT therapists, and we are training children's wellbeing practitioners. And both those roles and the educational mental health practitioners that exist in the mental health support teams in schools are all new workforce to children's mental health. They arrive with us, we recruit them, and actually what they then go into a training program, and they will then spend time developing those skills. So actually we are also continuing to grow the workforce, which obviously remains a major concern across many sectors, including ours. What we have done is to ensure that we make the progress that we need to make, is we do dedicate a role to transformation, and obviously Michelle, who's with me tonight, has spent is dedicated in that pursuit of the growth of those services, and has worked to be able to deliver both the mental health support teams in schools, the developments we've got in eating disorders and crisis, and to be able to make sure that Coventry and Warwickshire is seen across the region as an area of good practice, which is what we continue to aspire to. So I'm going to pause there and let Michelle just talk a little bit about the progress for eating disorders, and also talk about the progress in children in crisis. And obviously that work has enabled us to bring you some specific information as well for Nuneaton and Bedworth, which is as your request.
And before Michelle starts, massive thank you for bringing forward the specific data that we requested last year. And if it's I appreciate you probably had to take some resources in doing that, so thank you very much. Michelle.
Thank you. Yeah, and you're welcome. The data is really important. It tells part of the story. So certainly, yeah, it's something that we're working harder on. So specifically, just to talk about eating disorders. So in your paper, it starts at 5.71. We know this is a big priority across the country. I think when we were here with you last time, nationally, it was a very big conversation point, and we were seeing nationally rises, and a lot of those rises, which were above 60%, were pandemic-based rises, obviously remembering the journey that we all had, but in particular our children and young people. So certainly the investment has been well welcomed, both to be able to respond to the rise of services, but also to maintain the sustainable offer, because that's really important for our children and young people. Certainly when a young person presents with an eating disorder, it is traumatic for all of the family. So it is an offer that is not just for the young person, but it is for the family. And when I say the family, it's the whole totality of the family, which is a really important thing to just factor when you're thinking about the offer and the service that we deliver, because it is very intense for families, and it's very important to bear that in mind. So with investment time, so obviously NHS England have a very specific target, which Helen has referred to earlier, which is in terms of reaching 100% for 1 week. So they're referrals where it's urgent. And they're often young people that are very poorly and low body weight, and there's a significant concern for those young people. And then 4 weeks for what eating disorder, access and waiting time terms can routine. But obviously it's a very important thing to be able to manage. As you can see for the figures, we were struggling to achieve that, both because of the rise in demand for the service, but also part of the transformation was increased workforce, not only in terms of numbers of workforce, but the multidisciplinary team. And that's really important for an eating disorder service, because it's about having the right skills within that team to offer that multidisciplinary response. So when you think of the needs of the family, it involves family work, and that's a very important part of the plan. It involves physical health monitoring, it involves managing your cognitive behavioural kind of approach. So you can understand why it's a service that needs a whole range of disciplines within there. So we have done a huge transformation in that point, and it's really pleasing to see that from kind of March onwards, we have been consistently meeting the national targets, and that comes from all the hard work that the team have put in. One of the things that we also looked at doing with the eating disorder transformation was mapping the whole process, because what we also want to do, although we have a commission service, as Helen mentioned, in terms of the specialist response, if we don't do something and take that blend down into the early help and prevention model, we will always have this battle of children and young people facing the fear of their eating and the way that they look, their shape, their feelings. So we did this mapping exercise. Helen and I did this intense piece of work with the whole of the service. And what we could see, there was a need for more than what we provide, but we needed to lead on that. And that's been, again, part of the transformation and doing something different rather than more of the same. So we're working really positively with a voluntary sector organisation called First Steps, who are specialists in eating disorder offer. They offer also, really importantly, parent support. So these are for families where they may have been through the specialist provision, but they need to be still walked alongside, and that's really important for recovery from an eating disorder, but also where we're starting to see an emerging disordered eating, and they help support and understand that. And that has allowed the specialist provision then to be able to be responsive and see those young people that are acutely unwell with their eating difficulties. So you can see the second graph, which is 5.72, the percentage of the Nuneaton and Bedworth, and and being able to see the breakdown in figures is really important for us, especially in the connection with the Mental Health in Schools programme now, because that's where you get in early. So starting to see those really helps us to tailor and target specific interventions. So really, really positive element. We have some other parts in the eating disorder planning and transformation, which is, as Helen alluded to, from NHS England, which also involves an intensive home treatment service. So we've got a team now that are embedded in the service, which will be able to start to work with families in their homes. So really importantly, when you're having to support family meals, which is quite often a really pressured point for families who are needing those specialist provision, to have practitioners to sit alongside you as parents and carers, and also to work with the young person who will be distressed, to help that process feel better. And, you know, that's a really important part. So that team has now been recruited to, so we're really pleased about that. And they have started to work with that the first family intensively. So we'll look forward to, when we come back, being able to talk to you about the evaluation of that. The overall aim, of course, is to prevent young people needing to be hospitalised, and that's what we want to do. We want to keep people at home. So again, that's a really exciting new part of the transformation. We're also having done significant engagement work with the wider system. So there are our colleagues in paediatrics, speech and language, physio-OT, dietitians, developing an offer for ARFID. So ARFID is an eating disorder that is probably relatively new when you think of the terms avoidant restrictive food disorder, but it is a recognised eating disorder that is helped by psychological support. It is a challenge because nationally we're seeing something that we wouldn't have talked about 2 or 3 years ago, and all those parts of the service are trying to understand where their role is to support these families. ARFID quite often is in parallel with the neurodiversity need. So again, working really closely with our neurodevelopmental service is really important. And we're really pleased that we've got, and I use the word a offer because we're learning of the offer to get to the offer, but certainly taking advice and guidance from the Maudsley, where they also are still creating their offer. We're now at the point of starting to recruit to those posts and develop that. So again, that helps us to support that overall need for the needs that we're seeing in our children and people for eating disorders. So I'll pause there. Anything from my left or my right? No? Brilliant. Okay. I'll just move on then. Go on.
No, please carry on. Sorry, I
Okay.
thought you were close to concluding, but...
Yeah, for eating disorder, yes. I'll move on to children and young people in crisis then. So again, an area that we see unprecedented demand. This time last year, again, when we were with you, we saw a high number of young people presenting in A&E. Obviously, for our children and people who live in Nuneaton and Bedworth, that is often UHCW. We do have some young people that present in George Eliot, but obviously the highest proportion is UHCW. And there's been a change in the health landscape, I think is fair to say, for all of us. And we have seen some reduction in young people presenting in A&E, but obviously this time, a year ago, accessing other services, we were still coming out of COVID, weren't we? GP attendances and various other variable things were still there. But in totality, the referrals for crisis hasn't particularly changed. In fact, we've seen an increase. So the crisis umbrella of services has a range of things in terms of the response to our acute hospitals. We have an urgent community response, so we will respond to children and young people within 4 hours of them calling and their families or professional, and then arrange an assessment within the next 48 hours. But also we have a helpline that's dedicated to supporting children and young people. So it adds another layer to the COOS service that Helen mentioned earlier, because you are talking to a mental health practitioner over the phone, and sometimes that call results in us needing to see you. So we, again, it's a service that we're developing, and as we move towards the national 111 programme, we're obviously shaping all of that crisis work within that. We also have the Think Family Outreach team, which are a great team that walk alongside families while they're in particular vulnerability times. Crisis is quite difficult for all that are involved, but in particular what we hear from the engagement with children, young people and their families is sometimes we just need to be held while we understand why we're in a crisis situation. And that, I think, Family Outreach team does work both with the children when they're on the ward, so if they have needed to be admitted to the paediatric wards, but also in the community. But that walk alongside enhances the crisis offer. Obviously, we've broken it down for you, which I think is really helpful, because we can see for Nuneaton and Bedworth, 24% of the totality are our young children and young people and children from Nuneaton and Bedworth. And again, having this local data enables us to think differently as a system. How do we want to respond? And certainly if you connect that with the JSNA that Helen was talking about earlier, you can understand some of those reasons why. And I think one of the things, what we've tried to do in the transformation is loop everything in together, because there's no point having fragmented services. And one of the reasons why we particularly looked at the additional mental health in schools team programme being for Nuneaton and focusing on that 16 to 18 cohort is because that's an area that we see as need for children in crisis. So again, it goes back to that trying to stem the flow and being there early so we can prevent some of those crisis situations. And I'll pause there.
Thank you very much for your comprehensive breakdown of where we're at. I just got a generic statement to make, which then leads to my question. So I think technology and the rise of technology presents us with both opportunities but also threats. And I think from a young person's perspective, with the rise of video gaming, games consoles, etc., I do feel that young people are sort of retracting more to the home and not doing things outside of the home, which in turn is leading to loneliness, some of the generic mental health issues, not necessarily specific disorders related to in this report, but generically speaking, mental health issues. And I just wondered, do you think there's a need for the state to be more, and when I say state, local government, is there a need for local government to be more proactive in providing programs to get kids back out of their homes and actually doing stuff outside, whether that's well-being related stuff, physical sport relating activities, because I do fear that this is going towards a certain trajectory, and although it might not be your sort of area specifically, is it something that you think that we as councillors should perhaps be pushing more for?
I think we'll take two pieces on this. 'Cause I think first of all, I suppose that I think what we have to recognise is that actually children and young people are part of a community and a cohort, and one of the difficulties with that is that that they are engaging and supporting in activities that their peers are. So actually being involved online on the local game, if you don't know what that is, how do you then have that communication and that conversation? And I think it's a very difficult place to be able to do. There are proven benefits to exercise and health and well-being in that community and that team sports and team activities, but I think it is it's a very complex landscape at the moment for children and young people, because we've been through a period whereby that was their mechanism to connect with their peers. Actually, electronically and digitally was the mechanism for a period of time. And like anything, there is always a pressure, isn't there, to have the new things and to be involved in those. And whilst there's a big push to that, if you aren't engaged in that, there is a sense of how do you then continue to connect with your peers. But I think there is I think it is a really difficult sense for that. And Michelle obviously works not just in our region, but also works in Coventry and Warwickshire, but also does work across our region with other teams. So I don't know whether you've got any further insights into that challenge.
I have, and I think it's interesting because children and people are now starting to also not want to be engaging in a digital format. So for us as a service where when we were in the COVID pandemic, that's how we had to respond. It felt that's what they wanted at one point, but actually what we're now seeing is we want to be out more. And I always think, I've worked with children and people for many, many years. They're always amazing how they tell us what they want. So I do think that story is also going to come. But Chris is absolutely right. At the minute, if you try and detangle them from that way of living, it might become more of a pressure. One of the ways to manage that is things such as schools adopting the whole school approach, where you start to weave into the everyday language about you all being together and connecting in a different way rather than just via digital platforms. And I guess that's probably the best way for us to try and do that together. There are some absolutely fabulous groups where they do amazing work with young people, and certainly anything that can increase that. So when we're ready, we're able to be responsive for young people. I think that will be really important.
Just to come back as well, I think one of the other things that we note about our activity and intervention is the benefit of the voluntary sector and youth work within that programme, because actually creating that community beyond there is really important. And we are at the moment actually, obviously we've talked about the eating disorders work with the voluntary sector. We continue to do that work within the voluntary sector. And what we've also encountered is we're trying to provide a pilot to a model called ours, which is the additional reimbursement scheme that GPs have, and we are actually at the moment leading the way in trying to develop a model not dissimilar to the mental health support teams in schools, but in GPs, and that also has a youth work component, because I think actually what we want to do is to make sure that we can reconnect children with their childhood and their experiences and their community, and that remains an important note. None of us here want to be able to say that actually what we need to do is to say this child is ill in some way. Actually, they are responding to their lived experience, and we are continually trying to make sure we have both the specialist provision for those that really need it, but trying to make sure we continue to connect with the communities at large.
Thank you so much. Interesting insights. I think my Vice Chairman, Councillor Shires, you've got some questions if you'd like to.
Hi, thanks for all that. I think, and your reports are fantastic and brilliant of everything that you're doing. And I'm very aware from residents that, and generally, that as much as we're putting in, we're still not meeting the demand that's coming forward. I'm a governor at Camp Hill Primary School, and I know that no matter how much we seem to put in, there is still far more coming out. And yeah, I was listening with what you were saying and working in partnerships. What are we doing in partnership that's working with services that are supporting the parents? Because actually, I think we know that we learn from our parents what children display, sometimes what's coming from their parents. Their parents have mental health issues, financial issues, if there's a domestic violence situation, neglect, etc. That's then going to impact the children, how they learn their mental health. So it's what are we doing as RISE that is supporting the family in that sense as well, so that actually if we're looking at eating disorders, if we're looking at young people who struggle to eat, I know my son and I every day, what you're having for dinner, and we just look at each other in absolute, cheese sandwich then, because it's that decision that we find difficult. So it's for parents that potentially are in a situation where financially they're unable to provide a meal that would be considered as a nutritionally balanced, sort of what's happening around that to support. And then also, as part of that, we were talking about technology and how young people have become embedded in technology and they're starting to want to come out from that. But also how we see what our parents do, we learn from that, and how many people, adults, are working from home and have the home office and are refusing to go back into work because that whole being social and leaving the comfort is very difficult, and obviously the impact that's going to have and how that's becoming the norm, and then how mainstream life is actually not accessible for many young people, how actually all that having to fit into certain boxes to make to do a text, to be, behave in a certain way, whether that's at school, whether that's within playing football or rugby, whether that's within TikTok or something like that, it's also difficult, and we're seeing a far bigger rise in PDA, and then more young people unable to access school because of it, and specialist schools being unable to actually meet need because it's so I'm asking an awful lot. But I suppose the whole thing that's coming round to is, while we're looking holistically and we're looking at the whole family approach, where within that are we RISE actually working with organisations to secure funding that would enable them to look at the whole family, and I mean everything, right the way down to whether people have a bed to sleep in, and then how are they working that to ensure that we have the sustainability, because otherwise we can put a nice plaster on something, somebody reaches 18, they go off into adult mental health, have a child, suddenly you've got that whole situation again. So in 5, 10, 15 years time, we're going to be having the same conversation. So for me, it's about that, probably far too much. I'm more than happy for you to think about that, come back or have a conversation at another time.
I think we'll probably all have a little bit that we can put together. I think I think your points are really, really important, and certainly what we recognise really importantly is parent support is part of the need, absolutely. And in fact, sometimes we will do work with parents and not necessarily with the child. And again, that's really important for us to have that as part of our specialist provision, because parents are, the golden thread that stands there, and absolutely that's really important. You're right, I don't think we could ever, and I always say, transformation doesn't have a final destination, because we should never say that we're going to. And certainly the demand and the need, and I will always say the COVID pandemic, although we very rarely talk about it unless you listen to the news at the minute, it is still very much part of children's mental health, and particularly a cohort of young people that were impacted during transition ages, so going from year 6 to year 7 and 8, and also the transitions in secondary schools. They are still struggling with that loss of normality for those 2 years. So I will say we are still very much learning about what that is and what that impact is, not only on the young person but also the family. Working from home is a really good example, and for some of us, we have also become home workers, and we're there as a parent, but we're not available as the parent for that time. So it is, again, we're still shifting and adjusting, and again, I think they're really important conversations to have. We work really closely with our Warwickshire County Council Early Help Services. So again, that's a really good example how we neither of us have the only solution, but together we can create a better solution. So particularly families that feel that they need to have a conversation about something's not right, we're not sure what it is. We can see that it's a combination of both the young person feeling the distress, but often that distress is a result of lots of other factors that are just there because of the world that we live in. So we work together and we do joint consultations, and we actually tailor sometimes a plan that will be, well, we can lead on this part because we're the mental health lead, but what we recognise is the early help team, so that's the team that will sit under the Warwickshire County Council, the umbrella of social care. They will help the family with other elements, so maybe that support that's needed to put a meal on the table, an early help plan for the siblings. So we do try and do as much as we can, but I do absolutely recognise it's not enough, and certainly funding, and thinking I'll let Helen answer that one from that point of view. But we have got examples of areas where we've worked together to maximise what we can do in our gift, and always holding in mind that it's never a young person in isolation, it's a family bit.
And we do have and continue to have a parental offer for skills acquisition via our primary mental health team. That's a self-referral. You can ring up and book into those. We have both a training program and we also have a consultation program, and that consultation is always with the parent. It's always about trying to understand that experience and that lived experience of the family, and to try and take that as a family. And I think that it is really important that we recognise that, and you do raise some really interesting questions which I and much cleverer people than me and academics are going to write papers on. But I think that we've also come through, and I've been a mental health nurse now for 31 years, and actually when I started that, what children would talk about in school is completely different, and actually what we are encouraging children and young people to do is to talk about that, and what we have to be behind that is ready as adults to care for them and support them. And that's why the support into schools is really important, because saying that you're anxious, saying that you're worried is not a reason to be with our services, but it is a reason to be cared for, and it is a reason to be supported, and actually that's what we'll continue to do. And we do see that children are scared, they are worried, and actually they only have to see the news, which is probably fed directly to their mobile phone, and actually it scares us as adults to look at what's happening within the world, and so actually that is, and they see that. So I think we do have a challenge, but we have a challenge in upskilling everybody that has a role, and we are continuing to try and do that.
Just on that, around the parental offer, so it is something that, I think we recognise we do need to, one comes with the other, doesn't it? If they're not in a stable home, children and young people are going to struggle with their mental health, aren't they? So that is something that's recognised. And one of the things, so I work closely with the Adults Mental Health Commissioner, and she commissions Quell, which is the same thing as Couth, but it's for adults. So what we're trying to do is get those messages across when we're dealing with, when services are dealing with children and young people, or dealing as a family, they can have that access to that service as well for the parent. If the child is going through, you know, it's the service for the child, but then also there is some stuff that can accompany that for the parents. And also Warwickshire has recognised this as a gap. There is some work being undertaken at the moment, and Michelle alludes to funding, and that is the sticky issue really, is about how do we fund future offers that have that support that's what we call, I suppose, wraparound support for the family. So it is about helping and supporting that child, but also helping the parents or the foster carers or wherever they are, you know, whichever setting they're in, help them to keep that setting stable and understand their children and what they're going through, and also get the support themselves. So it is recognised as a gap, and it is a work in progress. So maybe in the future we might be able to come back with a bit more on that.
Thank you very much. Councillor Kandaka, I noted that you wanted to come in.
Thanks for the report, and the data is really useful now. I think what we need to do next year is have the data in the same format, and so we can do a nice comparison to see what things are progressing with. One thing we did have years ago were these 104-week waits and things, and one thing we don't have in the report is an idea of the outliers, you know, sort of the cases that are waiting a very long while. It's always useful to know about those. The second thing is it's always worrying your figure 6 on people present or children presenting in crisis, and it would be very useful to know how many of those are you're already aware of, and then how many maybe present again, or whether action is taken so they are then. I don't think you ever fix people, but yeah, that you've made enough intervention so they're not going back into crisis. So I think the data is very useful, but obviously we've got 1 year's worth of good data and you can't see where things are going. So if you could give us an idea. And finally, staffing has always been an issue. So it'd be useful to know how many sort of vacancies you have amongst your experts. Thank you.
We've got any short responses to those questions?
So in terms of the workforce, actually that's all is published within the local transformation plan. So actually you can view that document and you'll see all of the workforce programme over time. Just in terms of children in crisis, and I think that one of the things it's really important to do is to not make a connection between whether or not somebody is or isn't supported and whether or not they've asked for help in an emergency, and whether what we can do, and we have as a system run a dashboard. We're one of the first in the region 2 years ago to try and create a system dashboard for children in crisis, and that's gathering information from hospitals, gathering information from ourselves and from local authority. We are doing some work with that in terms of reviewing that. We've got 2 years worth of data now, and actually Michelle is leading on that, and certainly I'm happy in the next report and update that we do to try and bring some analysis of that, which will give you some progression over time.
Thank you very much. Okay, is it one? How many questions? Just the one. Councillor Harbison.
Yep. Quick statement, quick question. Thank you for coming back. Very much appreciated. Nice to see what's in there. A lot of the points that have been made, completely agree with. We've all seen the changes in children around us, the way they've become insulated, and we're trying to overcome that in various different ways. I applaud the broader way that you're approaching this and looking at it from a lot of different directions. Very good. Nice to see that we're performing very well. Thank you. Good work, always appreciated. Now, very quick sort of question. As a councillor, I'm now at the point, now that I've learned a little bit more how to do it, to look for the future, what we can actually achieve rather than just dealing with things. Do you have any sort of ideas of things that ideally that, you know, if you sort of had a big red button on the wall where you could say, well, if we could do that approach, or we could initiate this, or we could ring fence this, or whatever, you know, Orwellian phrase we want to use today, what would you do from a, you know, simple question really, that one. Thank you. Thanks, Chair.
If there was just,
if you had a big red button on the wall, what would you do?
If there was just one thing that you could do, if there was just one request, what would it be? Yeah. We're going to put the pressure on Michelle. Come on, Michelle.
I think for me, seeing young people present in crisis is the most heartbreaking, because quite often it's out of the blue, and that maybe the families are known to services, and I use the it's a plethora of services, or they just are not. And so if there was a big red button, it would be about having a greater crisis response that could be there before that crisis button is pressed. Because if you can undo that, then we will have a far better, healthier young person population.
And then the final question is from Councillor Pandare.
Thank you, Chair. It's just a quick question. Although we got the data for age and gender, do we keep the data for the ethnicity-wise different communities? Then we will know in the future if one community's mental health and disorder are a bit bad, then how we can overcome. Thank you, that's all.
Are you able to break it down that way potentially? I don't know if that's
yeah,
data you gather.
Potentially, we are required under the mental health minimum data set to keep all of such demographics, and what we could do with our data colleagues is in the next report try and give you some further analysis. I suppose we're just trying to strike a balance between what we bring in there, but I'm more than happy to, in our next report, to have a focus to look at actually where we might be underrepresented or where we're having particular difficulties.
It would be interesting if there was any specific trends, but yes. In which case, I'm going to bring this item to a close. I'd like to thank the three of you for coming and sitting in front of us and taking our questions. And I know that we know where you are now. If there's anything that we'd like to bring forward to you, and if there are any ideas that you've got that you feel that we as a Borough Council should be more proactive on in terms of our engagement with young people, please do contact us, because we would be really interested in knowing. So thank you very much. Now, you can stay for the rest of the meeting, but you may have homes, husbands, wives, children to go to, so you might have a life. Yeah, unlike councillors. Thank you. Yes, of course. Yeah. So, item number 9, which is the addendum that we have, is the petition, the public petition with respect to the Paul Bank Street car park. Now, under the new constitutional arrangements that were approved by the new administration, it is now possible for public petitions to be presented to overview and scrutiny panels. And because the specific petition is printed on page 2, received the necessary signatures, I was asked whether I would give consent for it to be presented to this panel. And in the interests of accountability and people being able to engage in the democratic process, I accepted that request. So the proposer of the petition, a Mr. Craig Barnes, was informed on the 29th of September that his petition met the necessary threshold to come to this OSP, and on Thursday the 9th of November was invited to come to address the committee. And I understand that Democratic Services have followed up. Unfortunately, Mr. Barnes isn't present tonight, so that doesn't give committee members the opportunity to try and get out, to try and understand what Mr. Barnes and the signatories would like to get out from this petition. So I was happy for it to come to committee, thinking that the proposer would come forward and present the petition. I'm not sure what we can really do with the petition, given that the petitioner isn't here. So if there's any comments that members would like to make with respect to the specific issue at hand, I have asked Councillor Golby to be here, and if there were any members of the public who wanted to speak about Abbey Street car park, but that obviously isn't the case. So I'm going to move a recommendation that the panel notes the report. Does that receive a seconder? That is seconded by Councillor Harbison. Does any member wish to speak to the to the recommendation, Councillor Kandaka.
It might be useful if the officers could give us a quick update on what the current operation of the car park is. 'Cause I believe it's a bit of a hybrid botchy sort of system at the moment where it's open some of the time by the theatre and they close it, but only if there's no cars in it. So it might be useful if, I don't know if the officers or Councillor Golby know what the current situation is to see whether the problem still exists, because I actually use the Abbey Theatre sometimes. I don't think I need to declare it because it's just a theatre, but I think it would be useful to get some clarity as to what happened since the petition started.
Yeah.
Because obviously a lot has changed.
Sure, I'm sure the Cabinet member could give us an insight to that.
Yeah, what happened since the petition has started is it's business as usual. The car park is being locked. The certain members of the local community organisations have got access to the car park whenever they need it, and that is it. I'm not sure what you mean by what has happened. If you can define that, it would be useful.
So if the Army cadets need access to the car park, they've got access.
And
the Scouts as well.
Yeah, they've got their own access to
Yeah.
use as and when they are needing to use it. What I will say is I've had actual residents around there give some very positive feedback about how ASB was blighting their lives and is now massively reduced based on the fact that the car park is out of service in the evenings. They don't get people congregating around. So actually it's having a positive effect on the area. But if you can define what you mean by what has happened, it would be useful for me to be able to answer a question.
I mean, our administration was elected on a mandate of, getting really tough on antisocial behaviour and basically stamping it out. We will do whatever is necessary to stamp out antisocial behaviour. We have a zero tolerance policy on antisocial behaviour. We won't stand for it, and we will do whatever is required to prevent it from happening. And as far as I can see, the steps are fairly proportionate. So, yes,
Yeah,
Councillor Golby.
And to come back in on that as well, the closure of the car park has been supported by the police. They actually publicly came out and issued a statement to say that they support this. And also the residents support it too. And according to the council papers, there's 181 signatories on the petition, which we've got 130,000 people in the borough. So, proportionate-wise, it's not a great deal of people that have signed the petition. However, we have not wholesale blocked access to the car park. People have access when they need it. And that is the key thing, when they need it.
So I've made a recommendation that we note the report. That is being seconded. Are there members who wish to speak to the recommendation? I see no indication, so I'm going to put that to a vote. All those in favour of the recommendation? So that's 4 in favour. Any members against? So that's 4 votes in favour and 1 against. So the recommendation is carried. So the petition be noted. So we now come on to item number 9, which is on page 36. We have a report from the Head of Economic Development and Communities on the Community and Voluntary Sector Performance Report. Abu, great to have you again this evening. How are you?
I'm good, thank you, Chair.
Good. Would you like to present your report to us?
Will do. Thank you very much, Chair. So I think most of the elected members know the background to the two organisations, so I won't go through that in terms of Warwickshire Carver and Citizens Advice Bureau. So Warwickshire Carver is our infrastructure organisation that supports the entirety of our third sector. We have CAB that provides generally support to all residents across the borough. So you have the performance report for Q1, Q2 of 23-24, and it's quite lengthy, it's quite detailed, so what I just want to do is just kind of pick out some of the key points and the highlights. What we're seeing now, based on what the organisations have fed back to us and what you see in the report, is very much chimes with what was said earlier by colleagues from health in terms of we are pretty much back to a normal, but it's a new normal, particularly in terms of the community and voluntary sector, in terms of how We're seeing groups come back fully fledged to some of their activity, or not come back to that, or people have moved on, or circumstances have changed. So what we're adapting to now is that kind of people trying to get back to running their organisations in a way that they were probably doing pre-pandemic. So the landscape has very much changed in terms of how some groups are operating, and particularly for Warwickshire Carver that supports third sector organisations, that's been an interesting challenge with opportunities as well. So that's been one of the kind of key points. And when you see through the detail of the types of organisations, the areas that they're supporting, particularly kind of governance, the ways organisations are setting or set up, the support that they need, funding, they're the kind of key areas of focus for Warwickshire Carver. They also, for the contract, in terms of the contract that we have with them, provide volunteer support and volunteer development. And again, within there, the numbers are there in terms of what has been picked up, what has been delivered for Q1, Q2. As an example of that, they were a massive supporter of the work that we did with the Knife Angels. So all the volunteers, the coordination of recruiting all the volunteers, the management of those volunteers throughout the whole of June, Warwickshire Carver did that in partnership with us, the police and the County Council. So that's just an example of how very, very quickly in the space of 2 weeks, they came on board and supported us with that activity. You can see the number of groups that they're supporting, the activities that they're supporting, and the performance broadly is really, really strong. There's no areas of concern. With regards to Citizens Advice Bureau, you'll see there that over the kind of 2 periods, almost 5,000 clients were seen on almost 12,200 different issues. So what we're seeing is, particularly downstairs, in Bedworth, there is a real busyness in terms of numbers of residents coming forward, needing help, and often needing help on a multiplicity of issues. So it's not just a single issue, and the CAB is very, very important in terms of that first point of contact for residents often in a state of sometimes distress, vulnerability, or just not knowing where to start with their query. The ward, in terms of, or wards for the 2 periods that the highest number of clients came from, was Abbey Ward, and again the 2 areas which generally seldom do they change, debt and benefits, but there's lots of detail because it's almost the entirety of the report is about 40 pages with lots of sub-data and detail that you can kind of look into. If there's any queries, any questions that members have, I'll take those now, or we can get Alison or Bill to come back to you. Thank you very much, Chair.
I do have a public speaker on this item, and that's yourself, Mr. Smith. You know the drill. If you'd like to make your comments, if you could put the microphone on.
My main concern is the housing department, and certainly the emergency and homeless provision. It's run for the greed of those who run it rather than the need of the people that use it.
Okay, so this is about the housing department.
Yes.
This is
housing.
This is specifically about the Citizens Advice Bureau and Warwickshire Carver.
They cannot deal because of the people that fund the Citizens Advice, and Carver. I've had to speak to both of them on a few occasions for dealing with this council and its housing department. They can't deal with it because you fund them. So there's no avenue in which any of the residents can get any action done against this council. Like I say, that the emergency and homeless situation is run by run for the greed of those that supply it rather than the need that those who use it. 300 or 400 times.
Okay, order.
Money
order
taken out of the council's money.
Order. This is about the house. So your comments are about the housing department and your specific issues with.
And the reason
this item
we cannot get.
Can we just stop the clock? Can we stop the clock?
Cannot get
order.
Any redress.
Mr. Smith, I will let you carry on, but I need you to understand this is about Warwickshire Carver and the Citizens Advice Bureau. Your comments need to be on that specifically.
This is specifically what they cannot do. because of
What
who
is it they
funds
cannot
them.
do? Because you're
They
again.
cannot help
I thought we got over
people
this. You're making very
with
specific
problems with this
allegations again.
council. I am making some very serious allegations. I've been targeted. My family's been targeted. Yeah.
Okay.
On social
Okay.
media by
I'm-
cabinet members.
I'm bringing this to
Yeah.
a close. You either speak about Carver and CAB or you don't. What is it?
Speaking about the things they cannot address because of who the criminals that fund them.
Okay.
And that is the council, yeah, who are responsible for most of the suffering in this borough, yeah.
With respect,
The contracts you ask people to sign in order to get, and the charges you make, yeah, 3, 4, 5 times higher than what the government recommends, yeah, by NABCEL and
nonsense.
the homeless services.
Mr. Smith, I have to jump in here because actually you are currently putting out some pretty severe allegations against CAB and Carver that puts them in a very negative light. I can assure you, CAB and Carver are charities. They run their own services. While they are maybe receive funding from a council, they are a charity and they act independently of the council, and they work so very hard to tell everybody that they work independently of all statutory authorities to enable them to engage effectively with residents. When people start saying that they are funded and are therefore restricted by statutory authorities, that reduces the amount of people like yourself, vulnerable people who access them. So I'm really sorry on that. I will guarantee you that there would be no reason at all why a Citizens Advice Bureau would be unable to advise any resident on housing issues just because they receive funding from Nuneaton and Bedworth Borough Council, and that is the final that I'm going to say on that matter.
It's the actions of the Nuneaton Borough Council we cannot get any redress on.
I just need, for those who are watching the proceedings at home, the comments that have been made by Mr. Smith are not accurate.
Publish
And
online the contracts
they're
you make
not
people
accurate. And
Publish
for those who are
online
watching the proceedings at home,
contracts you make
if you
people
do have to
sign to
access
access
services from
any-
CAB, then you
any
can do
help.
that freely.
And the
We
cost
as
of it.
councillors have routine meetings with
And the cost of
CAB,
it.
the volunteers at CAB.
I'm
In
not
fact,
having a go at
we
them, they do sterling work.
we
Yeah.
have routine
Just
meetings.
when we have to deal with
I'm-
new people,
ca-
we can't get any redress.
Mr. Smith, councillors have routine meetings with CAB and Carver.
what good's that?
If there are occasionally things that
What
CAB
good
and
are
Carver
you?
have to
You-
bring
you
to our
lot are the
attention.
problem.
Order! I am speaking
You
as the
are the
chairman,
problem.
Mr. Smith.
The cabinet members and executives of this council are the problem. Publish online the costs that you charge this council for the homeless services. Publish
Mr.
it
Smith,
online.
Mr.
And the
Smith, that
contracts
has
you
no
make them
relevance
sign.
to the item being discussed.
And the
I'm asking you to
contracts
now
make
to
them
leave the
sign.
meeting because of the disruption that you are
Yeah.
causing.
It's not in there. Publish it online. Publish a contract and the charges that NABCEL and other homeless providers, yeah, that come through the council, you can get it at a fraction of the cost in the private sector. Yeah?
Mr. Smith,
My
I would now like you
my
to
Take
leave the
away
suggestion-
meeting.
people's right.
I would now like you to leave the
Take away
meeting.
people's right to redress with the contracts you make them sign.
I'm happy
Yeah.
to discuss this on a one-to-one basis with Mr. Smith. This is not the environment to do this because you're not backing up anything you say.
I'm
But
not- I'm not going to
happy
have-
discuss it on a one-to-one basis.
I'm not going to have a forum that allows. I'm not going to have a forum that makes allegations against volunteers in a charity that do a lot of good work in this community. So we are going to move on back to the item at hand. So we've had order. Everything is published online, Mr. Smith. Can I ask the committee clerk to make sure that the our porter sees Mr. Smith out of the building. So I just won't have a forum used in public to slate volunteers. So we're going to move back to the item. I'll try and bring this back to a sense of normality. Could you just close the door if possible, just to... So the report, just on page 67, obviously that gives the breakdown of the issues that people are coming in to access, and it is striking that the major issues are financial related, debt 2062, financial services and capability 413. I know tax is only 37, but they are all money related, and I wanted to make the point that I think financial literacy is becoming an issue locally. I think far too many of our young people are leaving school not knowing how to access banking, how to bank, how to invest, and how to handle money. And I think perhaps financial education needs to be more prominent for young people, especially those who are at school leave age. So I just wondered if a point could be made more generically, Abu, and I don't know how we could facilitate this, because it's not actually part of the national curriculum, I understand, but I just think we need to be a bit more proactive around financial education. I'm not talking about for adults, I'm just talking about for young people of school leaving age, so that over time, some of these, we're more proactive about making sure that these issues don't come about in the future. I hope you understand my point. Yeah.
And on that, Chair, yeah, I think I'll double check and I'll probably come back to you directly. But in terms of the wider work around financial inclusion and the strategy that there is that straddles us and North Warwickshire, I'm sure that's included. And I guess the salient and important point is often when you've got individual residents coming forward to the CAB with those issues, and then it's Warwickshire Carver that is doing work with organisations that either come back on that, or organisations that developed to address some of those things. So that's where the two organisations are really, really important together. However, in terms of young people, I'll have a look through the financial inclusion strategy because I'm sure there's some work being delivered already, but I'll come back to you on that.
Councillor Knocker, is it on this? This is on the item, yeah? Yeah, go ahead.
Carver doing an immense amount of work, CAB are doing an immense amount of work, and it'd be really useful to have the timeline of how many cases Q1, Q2 going back over the last 13 years, because I don't think the CAB have ever had so many problems to deal with. And you see so much about the fuel crisis. A lot of the people here have got issues paying their energy bills, their water bills, etc. And so I think it is useful to see the workload. Having these really good detailed documents is more useful if you actually see the timeline. So actually you can see, as particularly the fuel prices have gone up, how much more demand that has placed on debt. And a lot of these people are hitting the perfect storm. No amount of education can cope if your income is £1,000 a month and your bills are £2,000 a month. Yeah, there are some people in serious financial trouble because of things doubling in cost, particularly energy. And I'm noting here's quite a lot of stuff on energy fuel vouchers, and energy. So I don't know if that's a thing we can actually look at and try and get some more information on, because yeah, sometimes these people are presenting far too late. They're already in a big hole, aren't they?
Okay, just say, for the avoidance of doubt, before my comments start being put on social media, Councillor Kondaka, I'm not saying the issues being presented are as a result of the lack of financial education. I understand the situation we are in with the cost of living. I'm saying is I think it needs to be more prominent, within our education system for young people, so that when they come to the point of employment, they know how to bank, they know how to save, they know how to invest. I think that's really important. Abu.
Yeah, and just say in terms of the request around kind of maybe trend data over a long period, I'll pick that up with Bill and Alison and see if I can come back to you directly on that.
Councillor Shires.
Hi. We all know I love third sector and CAB and everything that they do. I think what always disappoints me is that Carver and CAB don't actually attend these meetings to put forward their reports, purely because, as we saw from RISE, when you're putting forward your report, you can put a bit more humanity into it. You've got a bit more expression. You've got that thought, and you can relay things that potentially on the report. The report is very black and white, with also a lot of acronyms and short words that potentially people don't always understand. So that's always a big thing for me, and that's something that I've always made sure I've done. I've always made sure I've presented my reports and been able to give a backstory, which is usually what hits people more than actually what's in writing. So it would be really great for Carver and CAB to, in future, I don't know if you can put this forward, Chair, to attend, to put their reports forward. I'm also seeing a lot, and they've missed an opportunity, I think, tonight to look at partnership working with RISE and potentially diversifying their funding, because that is something that does concern me with the voluntary sector and with CAB, that while they receive grants from ourselves and they're doing a great job with regards to the financial side, actually there's something about diversifying funding. And they're making statements of they've improved mental health in clients, but actually how can they prove that? What evidence do they have? And then what is the impact that is having on GP appointments, the NHS, housing, etc., from that? Because there's a whole business case there. I think the voluntary sector are completely and utterly missing. With regards to the financial capability, and I know I was harp on this, and it's because I developed it, we used to deliver that to schools within Coventry and became part of the sixth form curriculum for delivering financial information support sessions to young people to ensure that by the time they left school they knew how to bank, all of those various things. So it has been done. Warwickshire were going to take it on, but then they didn't, and the CEO of Nuneaton and Bedworth CAB knows exactly all about that. So I think for me it is just it would be really great if CAB actually made the efforts to come along and then explain to us as well how they're looking at diversifying their funding moving forward to ensure that they're sustainable and to ensure that they can continue to meet the need of residents across the borough. Thank you.
Abu.
Yeah, just to say, I think Bill was here 6 months ago, so they are invited alternately. So you have CAB come to one, because we obviously do two throughout the year. Okay, I'll double check, but normally you have Alison come to one and Bill come to another. Okay.
And I have met with Bill as chair at the Bedworth office and I probably am scheduled for another meet at some point. I try and do it once every 12 months, but there's no reflection on Bill. He's a very busy person.
Absolutely.
Right. Okay. Well, that's understood.
It's a volunteer, anybody. It
But-
doesn't necessarily have to be.
Yeah.
I'm just thinking it's nice when we're looking at this to get that.
And historically, over years, having presented this report, you'd always have one, so it'll always normally be the head of the organisation. So I'll make sure that happens. And in terms of no, it's absolutely a valid point. It's a valid point. And in terms of that bit around funding, I think there's a really important point there. So, for example, one of the projects that Carver delivers is around social prescribers, and so that tallies with a lot of the services that Chris covers, and also in terms of CWPT. What Carver have to be really, really careful for in terms of the third sector is the areas that they apply for funding directly and deliver, and where they have organisations that are coming to them to apply to those same organisations and supporting them to to draw that down. But the point that you raised, Councillor Shires, is an absolutely valid point. So for them, it's always there to say where are the areas that they should be applying directly and where the areas where their members or the organisations within the borough come forward, and they have to support them with funding applications to tap into some of the monies that are available through the NHS more broadly, broken down by the ICB, whether that be CWPT or other kind of subsections.
Thank you very much. I'm going to let Councillor Harbison come in, and then I'll let you come back in, Councillor Kandaka.
Thank you, Chair. First of all, thank you for attending tonight. Always nice to see you, and thank you for your continuing hard work in all that you do. It is appreciated. Having dealt with Carver and the CAB quite a lot very recently, I've got to say they are fantastic organisations. The way that Carver have expanded, you know, they're encompassing a lot of different voluntary things for over 50s and stuff like that in coordination with the DWP, etc., is a fantastic way forward. I'm over 50 myself. Things get more difficult as you get older, particularly in terms of finding work, etc. A lot of residents have come to me and said that when they've been diverted towards CAB, I always look for feedback, and I always get good feedback. Same with Carver. In terms of what Councillor Evans said, I agreed completely. When I was at school, we had general studies which taught you things like how to vote, why you vote, how the system works. Also banking, the A bank used to come in, and we had an account with them, and it used to be like 10p a week you'd put in. It was nothing. It probably cost more to print the books than it did to actually have the money in the bank. But the point being that that, you know, there's a lot of challenges that probably weren't there 3 years ago, and I think they're adapting really, really well. I would echo what Councillor Shires said. It'd be lovely if somebody could come, but understand that, you know, sometimes people just can't make these things and know how it is. So it was more of a point than a question, but just to say thank you for all you do as well, and it'd be nice to see maybe a little bit more detail on subdivisions within the Nuneaton and Bedworth Borough Council, but I understand these figures are hard to come by.
Thank you.
Thank you.
Thank you, Councillor. Yeah. Anyway, I think well, on these things, I am sometimes a bit cautious that asking the voluntary organisations to break these things down into sort of O&S areas and then wards, if it can be done easily, fine, but I do worry that I'd rather them be spending their time helping people on cases. But can it be done?
The case system means they can break
The
it down,
caseworker system.
do it over national and everything. Oh yeah, it's really simple.
If that's
I know because I've done it.
for CAB, yeah. Could that point just be taken back, Abu?
Absolutely, Chair. I think the report combined for the two organisations is almost 40 pages at the moment. So if there's anything in there that you feel isn't in there, or what you'd want additional information, if you let me know, we'll get that picked up. But at the moment, that report over the years has kind of changed and been tweaked, and of course I'll pick that up. But yeah, it's quite a chunk out of that entire report. It's about 40 pages for the two organisations. So just let me know and I'll pick that up.
Thank you. Councillor Kandaka, you can come back in.
Thank you. I thought it was a very good idea going to them and having a chat, which you said you're going to do. It might be useful to have a couple of other councillors there, so we're not all repeating the same exercise. Thank you.
My last meeting was Bill was as chair of the OSP, but also to discuss some Bedworth related issues. That said, I'm sure as a political leader in the borough, an esteemed leader, I'm sure he'd be more than happy to see you, Councillor Kandaka, if you wanted to meet with him, and I'm sure that could be arranged. He's very, very open. I get what you're saying about repeating meetings. It's a fair point, but yeah. Are there any other comments? No? Okay. In which case, Abu, thank you very much. I'm going to move on to item...
No problem, Chair. Thank you very much.
God,
one thing I'd just very, very quickly say is Alison or Bill, in particular Alison at the Newtown Centre, welcomes any elected members to come down any time,
Quite right.
see the operation,
Yes.
and see it as
Yes.
Councillor Shires displayed. But yeah.
Yes. Good. So we'll go on next to item number 10, which is the damp and mould inspection performance. And I believe that we've got Jason from our housing department. Can you, I think you may not have sat in front of the committee before, Jason, so if you could just introduce yourself and then present your report, we'd be most grateful.
Of course I can, thank you, Chair. I'm Jason White, Responsive Repairs Manager. I work within our housing department, carrying out, obviously, repairs to the properties within the borough. Initially started with, obviously, works around the damp and mould, and that's why I'm going to present the report as such, but obviously have moved on to sort of different roles as such. So I would like to sort of go on just to sort of give an overview essentially of the report, and then obviously if there is any questions etc at the end of it, then obviously happy to do so. So since Royal Assent in July 2023, the Social Housing Act 2023 has now become law. So although many provisions within the Act require regulations before coming into force, this isn't expected to be published until 2024, next year. As part of the Act, the regulator of social housing can take action against social landlords before people may become at risk within their homes. Additionally, the Secretary of State now possesses the power to instruct social landlords to investigate and rectify serious health hazards. A task force was put in place earlier this year to focus on damp and mould. This team was assembled to review our practices with how we approach damp and mould and established if more can be done around this subject. Alongside this, we are currently undertaking stock condition surveys of our properties, and this is to ascertain property condition and if there is any sort of Cat 1 and Cat hazards within the property are also established at this point. So it isn't solely focused around damp and mould, it's to see what the condition of the property is as a whole. To date, the approach we've been taking as a collective is starting to show positive signs, and this can be reflected in the following slides that obviously we've got within the report. So I'd like to just to go on to carry on around that. As part of the task force originally formed, an action plan was created to help measure progress around damp and mould. This has been broken into four categories as shown, and emphasis has been placed on becoming a more proactive service as opposed to reactive. There are a total of 129 actions on this action plan, 60 of which are complete, 44 in progress, 14 yet to be undertaken, and 11 have been deferred. We are also in the process of providing damp and mould training to frontline members of staff to enhance their knowledge, and we will have around 112 members of staff have completed this by the 1st of December, which obviously next week. As previously referenced, we've had an external company carrying out stock condition surveys to our properties. A completion date of March 24 is currently in place, and we are currently on course for this. This survey provides information around condition as stated before. So category 1s are essentially risk to health, etc. Category 2 hazards are obviously hazards in which can cause harm, but not to the severity of category 1. So hazards that may be presented. In relation to damp and mould, at the time of this report, we received 82 Cat 2 hazards and 20 Cat 1 hazards. From these reports, works are raised as a result, but there has been occasions where we've done follow-up inspections to understand sort of obviously pathological sort of issues around the property, etc. So it isn't just a case of that once it's raised, works are raised. There is obviously more in-depth search and to ascertain what is the causation of obviously any damp and mould. To date, we've received 402 reports of damp and mould. Obviously, this is obviously from a reactive point of view. This is from our residents reporting and anything within our sort of ILO blocks and stuff like that. Historically, as an organisation, we've always been a reactive service towards damp and mould. It's always been sort of let it come to us as opposed to us going to find it. Obviously, this means that the resident would call in, whether it be at an early stage of essentially damp and mould or whether it be when the room is consumed with it. But essentially, we always come as a reactive point of view. Although this approach is still part of what we're doing, we are still reliant on obviously residents calling us and ringing in to sort of report it. As stated, we are obviously looking to become a more proactive service. So we are obviously actively seeking damp and mould, obviously, problems. In quarter 1 and 2, we attended 271 inspections of damp and mould. And as a result of those searches, of those inspections, it would appear condensation is the highest cause of damp and mould within the property. There is obviously other causes, such as penetrative and what have you, but essentially condensation is our biggest issue within our properties as it stands over Q1 and Q2. We are becoming more proactive service and actively seeking damp and mould, and rather than relying on being notified, we've essentially looked at property type, which could be at higher risk of damp and mould. We've looked at vulnerabilities within our properties, and we've kind of established a high, medium and low priority list to work through this. So this has been established initially around the 1,700 figure of what we've deemed as a high, medium and low. We're currently working through those, like I say, as a proactive point of view as opposed to a reactive. This has obviously been undertaken at the start of the year, but progress has been slow due to staffing issues and due to sort of restructure with teams. I am confident over the next Q3 and Q4, that will start improving in terms of figures, in terms of getting around the properties and establishing sort of if there is any problems at all. Due to a better understanding around damp and mould and the fact that we as an authority, we want to be more accountable in terms of issues, instead of relying on obviously pointing fingers of blame, etc., we do want to be accountable within our actions. We do want to sort of work with as opposed to point at sort of thing, and that is what we're sort of working towards, and changing sort of cultural sort of views on what we have done. We are looking to be a more progressive section and, as I say, work with as opposed to point at sort of thing. So if there is any obviously questions, I'm happy to sort of take that. So thank you, Chair.
Jason, thank you so much for giving us a comprehensive update on the work that your team is doing, and it's good to see that we're being more, we're changing it, we're being more proactive than reactive, and long term that's the right way going forward. Are there any questions or comments that members would like to make on this report? Councillor Shires. Did it go first? Go on then, Councillor Condarca.
It really was more or less a dead heat. I've had quite a lot of tenants over the years had problems which the council's reacted to and solved their problems. It's really it's one of the things the council's actually done quite well when there's been a problem, but it's really pleasing to hear you're going to get ahead of this stuff. And a lot of our buildings were built in the 70s and actually have structural problems that make them damp, and particularly things like the windows are now getting to the ages where they're starting to the gas, whatever seals are blown. Is there sort of that all part of the surveying, and is some of the window replacement programs being tied in to match the damp issues, so you're doing them in the right order for where the problems are greatest? And I particularly notice around a lot of the accommodation in Wellington, some of the north facing sides are obviously a lot more of an issue than people who've got the natural the sunny side. So I say, if you could just sort of tell us what sort of maintenance you're doing, and if the capital programme is actually being used to make these places less damp. Thank you.
Jason.
Yeah, so the capital programme is obviously in line with what we are doing and what we are trying to achieve within repairs. With the high, medium and low priority list, it's identified a consistency, and what we've established is that needs the work, property types that need the work, are consistent with what is on the programme anyway, as you've said, due to property age, due to property design, etc. So there has been certain consistencies within the data that we've collected in terms of where we are in terms of programmes created by our capital projects team. So yes, the short answer is yes, it is consistent, and we are changing windows, doors, as well as obviously the EWI works, etc., that are being undertaken, and that does, as I say, coincide with what we've established as a priority list in terms of high, medium and low.
Thank you, Jason. Councillor Shires?
I just actually wanted to say that I've had some first-hand experience dealing with the damp and mould with yourselves and with the team, and also with fencing and repairs in general, and I just wanted to put out to members that actually I'm really quite impressed and very pleased with everything that's been happening so far and the prompt responses, etc. So really, for me, it's no real question, but just to feed back to you both, I'm actually really happy, and it's great to be able to work with yourselves and get such good positive response, and for residents to be coming back with how happy they are. So that's just great. Thank you.
Brilliant. Likewise, with some of the issues I've reported at Alderman G Hall, very responsive. So out of this, could I please be given, Maria, could you sort out with Nicola? I'd like to have a list of every staff member who works under Jason's team, so I can send a personalised thank you note to every single member on behalf of the committee. Now, I don't think there's any more points in this item, so I'm going to close this item, and I'm going to move now to item number 11, which is the tenant satisfaction survey that is being reported to us by Nicola, our Assistant Director. Nicola.
Thank you, Chair. I'd just like to apologise from the outset. There were some formatting issues in my report, so I do apologise. I just wanted to highlight that with you.
I didn't notice.
So, yeah, tonight I'd just like to present some information regarding the tenant satisfaction measures. So just to put it in context, in 2020, the government published a Charter for Social Housing Residents, which is the Social Housing White Paper, which sets out ways to improve things for people living in social housing. And some of those things are also for the regulator of social housing to do. And one of those steps was introducing a set of tenant satisfaction measures. And what the regulator are saying is that those measures should let tenants see how well their landlord's performing. And it also gives the regulator an idea of which landlords might need to improve on the services that they're providing to their tenants. So the white paper goes on to say that landlords should keep properties in good repair, maintain the safety of buildings, handle tenants' complaints effectively, engage with tenants helpfully and with respect, and take a responsible role in managing their neighbourhoods. So the Council have actively been following the progress on the implementation of the TSMs, and as the report highlights, the Regulator of Social Housing advised that all social landlords from the 1st of April this year need to collect and publish data relating to the tenant satisfaction measures. So, as the report states, the tenant satisfaction measures are split into two parts. There's a tenant perception survey, but there's also another part that relates to data generated from management information that we hold. So for the tenant perception survey, what we did was sent out a survey to all tenants. We did that throughout June, July and August of this year, and it was sent out in a paper survey. So we didn't telephone, it was all just paper-based. Landlords did have an option of how they did the survey. Some went through, knocked on doors, others did telephone calls. We decided to send out a paper-based survey. So we sent a chaser letter out to tenants as well to remind them to complete the survey and send it back to us. So a total of 5,629 surveys were sent out, and a total of 1,507 were returned. So we got over 27% of surveys returned, which was quite good. We did do an incentive as well. So we said if residents got their surveys back to us by the 19th of August, I think it was, that we'd be entering them into draw to get a £25 gift voucher for Asda, I think it was. So I think that helped. So there was 12 questions that were asked in the survey. They had to be asked in the way that the regulator wanted us to ask them. We couldn't change that at all. So the first question was, how satisfied or dissatisfied are you with the overall service that your landlord provides? And this just relates to housing services. So from that question, we had 80.85% of tenants who were very satisfied or fairly satisfied with the overall service. And that actually is top quartile performance. The second question was, how satisfied, dissatisfied are you with the repair service that we offer? We had a total of 80.89% of tenants that were very satisfied or fairly satisfied with the service we provide. Again, that was top quartile performance. The third question was satisfaction with the time completed to complete a repair. We scored 78.82% in that question. Again, top quartile performance. The fourth question was satisfaction that your home is well maintained. We scored 79.56% on that question. Again, top quartile performance. Question 6 was how satisfied or dissatisfied are you that your landlord listens to tenants' views and acts upon them? In that score, we received 66.37%, so not as high. I think we were second quartile performance for that. But all of these demonstrates where we need to improve our services. So this is what we'll be working on going forward. Question 7 was how satisfied are you that the landlord keeps tenants informed about things that matter to them? We scored 72.89% on that one. Question 8 was agreement that the landlord treats tenants fairly and with respect. We scored 75.83% on that question. Question 9 was how satisfied are you with the landlord's approach to handling complaints? Low score on that one. It was 47.96%. We recognise across the council that we need to improve on our complaints process, and we've already started to look at that. But actually, we were top quartile performance for that. So after meeting with HQN, their chief executive had been looking at the data that's already been coming through, and some landlords have scored as low as 15% on complaints and antisocial behaviour. So we were top quartile, although it's low, we were still top quartile performance for that. Question 10 was satisfaction that the landlord keeps communal areas clean and well maintained. That was 70.4%. Satisfaction that the landlord makes a positive contribution to neighbourhoods. We scored 58.37% on that one. And satisfaction with the landlord's approach to handling antisocial behaviour. We scored 51.92% on that question. We had the opportunity to put some sub-questions in if we wanted to. So I did on that particular question. So I asked whether or not tenants had reported a case of antisocial behaviour to us in the last 12 months, and 25% hadn't. So I think next year, because we have to do this every year, I think we need to think about other sub-questions that we're going to put in to delve more deeper into tenants' views. The 11th question was, I think I've done that one, haven't I? Positive contribution to neighbourhoods was 58.37. So I'm really happy overall with the results that we've received, particularly that we're performing in top quartile performance and even second quartile performance. We're yet to report on the management measures, but if with your agreement, I'm happy to bring a further report to the panel in next quarter. So those will detail the proportion of homes for which all required gas safety checks have been carried out, proportion of homes for which we require fire risk assessments, proportion of homes that have required asbestos management surveys or re-inspections, proportion of homes which have required Legionella risk assessments and how many of those have been carried out, how many community passenger lift safety checks have been carried out, proportion of homes that do not meet the decent home standard, proportion of non-emergency responsive repairs completed within landlord's timescales, and the proportion of emergency responsive repairs completed within our target. And also there's some data that we need to feed back in terms of how many stage 1 complaints we've had per 1,000 homes and how many stage 2 complaints we've had per 1,000 homes, and how many of those complaints were responded to within the Housing Ombudsman's complaint handling code timescales. So overall, really, really pleased with the performance that we've got. Thank you very much.
Perhaps under antisocial behaviour, that related question, perhaps one of the sub-questions could be, are you aware that Nuneaton and Bedworth Borough Council has evicted 7 tenants for antisocial behaviour? Yeah, really good positive work going on yet again in the housing portfolio. It's certainly one of the more successful council departments in the authority. See, on the letter, did we have a QR code for people who wanted to do it digitally? Because I presume it was free post. Was it free post?
It was free post,
Yeah.
yes.
So I'm just thinking there is obviously a sort of a slight administrative cost to us to do this. And I just wondered if there was a QR code, not only would it mean if people just want to do it digitally, they can, it saves them walking to the post box, but also it might increase the response a bit.
I don't think we did. I'll double check and I'll feedback. I don't think we did. What we did, we commissioned an external company to carry out the survey for us, and they collated all the responses. But I can double check. I mean, it's something that we have to do this every year. We put barcodes within our newsletter and on Facebook and everything else. So I will double check, but it's definitely something that we can move forward with next year if we haven't done it this year.
I would be grateful if the cabinet member could just explore whether it might be cheaper to do that work in-house, because our business support team should be able to do something like that if they've got. Obviously, of course, we hold all the addresses of our tenants. You'd hope so. So we should be able to do that in-house. But okay.
Yeah.
Right. Okay, so is that going to have to get to procurement then if it's something that we're going to have to do on an annual basis?
We used a framework for it, so yes, we did. Yeah, I found, and because obviously it's the first year again that all landlords have had to do this, so we're getting good practice coming in. And actually, the Housemark report, I've had the mid-year report from Housemark, and actually, the digital stuff has come down very low. People haven't replied by sending out digital correspondence, but not all of the results are in yet. So there's a lot of learning for all landlords to take from this year's data, and there might be ways that we can improve on it next year. So yeah, we'll be monitoring it going forward.
Are there any questions?
Thank you. It's really encouraging, and I notice a lot of things I have got better this year compared to last, particularly like grounds maintenance. A couple things. It'd be useful to send a spreadsheet, 'cause I think you have got some formatting errors, so we can actually see some of the yes/no things we can't quite work out. But I say it's really encouraging, and it'd be nice to drill down. Do we have the data by ward? Would be a useful thing to know, or maybe councillors could be told what the responses are for like Weddington or wherever their thing is. But yeah, most things are very positive. And on the pull down questions, it might be useful to capture what are you most dissatisfied with, so we can actually work on our weak points, because in any system, trying to get better and better each year, if a resident might be happy with 99% or 90% of what you do, but there might be one thing that is a useful feedback in terms of what they think you should be doing better. Thank you.
Yeah, the yes/no questions haven't been pulled out as much within the report because we don't report back to the regulator on those. We only report back to the regulator on the TPO ones to TPO 12. I did speak to the company that we commissioned to do the survey to see if we can drill down into ward data. I'm sure that's something that they can do for us because, like the chair said, that they've got all our addresses and everything, and they know from who's responded. So yeah, and in terms of the other sub-questions, that is something that we can look into. We can add another 12 questions. Like I said, we need to review what we've done this year and what we feel will benefit us to improve services. We need to think about any sub-questions we need to ask going forward. So it's something that will be on the radar anyway. Yeah, I'll definitely monitor it.
Councillor Shires?
I just wanted to say well done. I work very closely with yourselves, and I have to echo what Councillor Condacour said. Of certainly one of the better departments, unfortunately, within the council to work with. Feedback from residents is always very positive about tenancy support, etc. So I'm really not surprised that you're getting that feedback. And with regards tenants knowing about evictions, I think you're going to find that in your next set that residents can go, oh yes, we have noticed this, because the feedback again has been quite positive on that. Okay, that was it really. Just wanted to...
Thank you. Yeah, I think what we've always gone, I think, under the radar a little bit. We don't shout about the good work that we're doing, so we're very keen to put out good publicity and use our communications team to get things out in public domain. So yeah, thank you. Really appreciate your comments. Thank you.
And just another idea as well. It might fall outside of the tender that's been agreed, but with the increase in resident engagement days that we're now seeing in the town centres, perhaps having some of those to hand might be useful as well. I don't think there's any... Oh, sorry, Councillor Harbison. Go ahead.
Thank you, Chair. I'd like to echo what's been said. Very pleased with this. Again, housing continues to shine. I'd like to take the opportunity to thank the Cabinet member for her incredible work. She doesn't get the credit she deserves, ever. And I live in a ward whereby there's been a noticeable change. It's quieter, it's nicer, it's just generally better. In terms of housing repairs, etc., particularly with the damp, the mould and stuff like that, it has been noticed that we are reacting better. Lidgate Court, where I live, is a hub of activity at the moment. There's all sorts of improvements going on. The place is picking up. Residents are noticing this as well. In terms of engagement, I think to have a broad spectrum of engagement possibilities is always a good thing. So if you can do it online, well, good for you. If you do it on paper, I'm a bit of a pen and paper sort of guy, so I like to do things like that. Just having a range would be excellent. But again, just to say thank you for all your hard work, and if there's anything you need from us, obviously come back to us. Thank you. Thank you, Chair.
Thank you very much. Do you want to make any final remarks?
Yeah, if I
Nicola?
could. I think resident engagement's been mentioned a couple of times. We know we could do better. We've known that we could do better on resident engagement. That came through on our STAR survey that we send out, and it's echoed in the tenant satisfaction measures. So it's one of the areas which we are working on. I'm just carrying out a restructure. I'm going to have another tenant engagement officer, and we've also got our new tenant engagement bus that's going to be out on the road very soon, so we can actually go out to listen. You know, with all the new social regulation stuff that's coming out, the new Social Housing Regulation Act. It's very much focused on tenant engagement, so we know that we need to do better, and we are making steps to improve things, so there's more to come.
Is it a climate friendly van? That's what we need to know. that was sarcasm, by the way.
It is when it's turned off.
Yes. Very good. Very good. Right. So I'll bring that item to a close. Nicola, thank you very much. Item number 12 is the forward plan as printed on page 96. That is for noting. Are there any comments that members would like to make on the forward plan? I see no indication. So next we will move to item 13, which is the work programme suggestion form, which has been submitted by Councillor Kundaka. That is on page 106 of the report pack. What I'm going to do is I'm going to allow Councillor Kundaka to present his scrutiny suggestion form to the committee. Councillor Kundaka.
Thank you very much. The council was awarded about £1 million to do some flood alleviation work to reduce the flood risk to the town centre. There is a lot of problems with flooding. Obviously, we've got climate change, we've got more development, building up all the areas around Nuneaton and creating more hard surfaces. And it was realised that a large part of the town centre is in what's called flood zone 3, which effectively means it's functional floodplain, so that when you get a large flood event, it's areas that are expected to flood. The County Council did a lot of work modelling what options could be to solve the problems, particularly in the town centre, so that it could be developed and the existing businesses could have cheaper insurance, and we were ready in case there was a major overtopping of the canal. Nuneaton flooded a lot in the 50s, and then they built the flood relief, which sort of cuts off flooding from the east side. But on the west side, we've just got more and more development that is actually cut off by the Coventry Canal. So all the development up Camp Hill, Galley Common, all that stuff runs down towards the town centre, and that's effectively normally intercepted by the canal. And interesting, some of the brooks, like Barpool Brook, actually are culverted in a tunnel that goes underneath the canal. It goes like an upside-down siphon. But we need to do something because the risks of flooding are getting worse. The insurance premiums, if you can get insurance against flooding, gets more expensive. And it was quite rightly realised it was something that would actually make the town centre more developable. Unfortunately, the whole thing gets very complicated, gold-plated, and a lot of it is down to computer modelling. So the people at County Council hired consultants in, and they modelled what would happen in a large rainfall event. And they've updated the models, not just for Camp Hill down to the town centre, but also for the other corridors going into Nuneaton. And a lot of our development is at risk. The museum's at risk, the fire station's at risk. And what we fundamentally need to do to reduce that risk is not pump water uphill, but actually delay the speed at which the water comes from Camp Hill or Hinckley down in the town centre, so that the existing infrastructure moves the water. And it's like anything. If everyone tries to arrive in the Nuneaton town centre at 6 o'clock, there'll be a chaos. If people arrive over a large amount of time, the roads cope. And it's the same with water. So what we're trying to do with flood alleviation is hold water as high up in the catchment as you can, distribute it around the place, and then let it flow into the various brooks so they don't overtop. They had an idea of how much they needed to work to stop the properties flooding, and they also worked out what properties were at risk. And it's 165 properties are at risk of flooding last year, and that will go up to about 290 in 50 years' time as we get more and more climate change. And so the idea was to actually have a short list or a long list and a short list of options as to where you hold water back. Fundamentally, most of those are in the Camp Hill area because that is a really steep valley. I mean, the member for Camp Hill will know if she's leafleting up from Queen Elizabeth Road up the side how steep that is. But that valley goes all the way back to Galley Common, and all that stuff comes down. And we have 2 existing ponds along the Bar Brook that are actually holding the water at the moment. And they are nowhere near big enough for the future. So the 2 options they were looking at doing, and the actual cost of them was about £1 million in terms of the concrete, but by the time you've surveyed it and designed it and allowed umpteen, it's about 5.7 million, was to actually have an area where some of the new housing, an area about 300 metres long and about 30 metres wide, with an embankment round, effectively the storage area, so that when the Bar Brook raises to a certain level in extreme weather, that area floods. So it's not a reservoir, it's not full of water, it's an area of grass that actually fills with water. And then down the lowest pond in Camp Hill, actually putting some embankments around it, so that when that fails to be able to go down the culvert, the grass around the area starts obviously get flooding, that actually holds the water for a day or so, rather than going down through the industrial estate and going, I think it's Pool Road, isn't it, and all that bit. And there's a little dippy bit in there that then drops into the canal. I totally understand we can't afford to do all this today. But the point is, the nature of flood measures is every bit of storage you do, every little bit of embankment you do, every time you have a bigger pond, that reduces the 165 houses that flood down, and every time you build more houses, that increases the amount of flooding. So we need to talk about this, and we need to talk about what measures we can do. And like there's 3 embankments and 1 pond, can we build them 1 in 2 years' time and 1 in 10 years' time? Can we start on this? Or if we can't do anything, can we tell people in the areas where the flood is expected to come, and the modelling says the canal will overtop near Richmond Road? I don't know how well you know that part of Nuneaton, Kyle. If you go up Queen's Road and you go where they're going across the canal, Richmond Road is where they think most of the flood water will come down, and then it'll flow down Queen's Road. It actually won't damage the new developments too much because they're built quite high up, but it'll actually go round to the fire station. And there's a nice, not a nice map, but there's a map of where they think Nuneaton will be most affected by flooding. And we always know Queen's Road's got a problem because it's already very flooded. There's some video of it. So I'd like this as a work programme item so we can get the County Council here. We can ask them what sort of options we can start to do. And both from the, can we start having some more flood storage around, particularly on the west of Nuneaton, and can we look at some of the options about raising thresholds? Because we can't solve it one way, we can solve it another, and it's salami slicing the problem. So I don't want it shot down because it's too difficult. Yeah, this is something we'll do over 20 years probably in little projects, but I think we need to actually accept we've got a problem, accept there's 290 properties that are at risk, and say how do we actually start looking at this. So I'd like it on the work programme, and it's very much a case of either having it the working group or having Warwickshire County Council come here, but I just want it to get progressed rather than just put on the side. Thank you, Chair.
Thank you, Councillor Kandaka. So, having looked at this, so this all comes down to money, whether we like it or not. So I'm going to move a recommendation that once I've read out, I will ask for a seconder. The recommendation is as follows. The panel resolves to invite the leader of the Green Group to present a capital programme during the February 2024 budget setting process, detailing how such a project could come to fruition, taking into account the Council's medium-term financial strategy. The panel will review the scrutiny suggestion form upon receipt of this information. Does my recommendation receive a seconder? Seconded by Councillor Harbison. Would any member wish to speak to that recommendation? Councillor Kandaka.
As Kyle well knows, and as I told him last time, flooding is a matter where the County Council is the lead flood authority, and this capital programme would be a County Council project. Which is why I think the first thing to do is actually talk to the County Council as to what we can do at a more modest cost, and obviously how it's funded. The County Council is considerably richer than the Borough Council. It can also get money from the Environment Agency. As you saw in the report, the full project would be eligible for £1 million of EA funding, and that will be asked for by the County Council. So you can ask me to produce a capital budget for the Borough Council to do it, but it's like the Borough Council building a motorway or a railway station. It's not a Borough Council's job. But what the Borough Council is the planning authority, and also we're the scrutiny committee to actually scrutinise what the county council's doing. And if you look in these minutes, you'll see there was a stakeholder group, which obviously the Green Party was not invited to, which had a whole load of borough council officers, county council officers, and one councillor from the Nuneaton and Bedworth.
Your point is a fair and rational one. It isn't a responsibility of the Borough Council. I made that clear at the last meeting, and I think officers have made this very clear to you. It is a matter for Warwickshire County Council, which I think you agree with. My only point would be, if you agree with that, why have you brought it forward to this committee?
Chair,
Because in the scrutiny suggestion form, there's no reference whatsoever about, us bringing in Warwickshire County Council. I think it might be a matter for an overview and scrutiny panel at Warwickshire County Council to consider, but based on what you've written, I've got no option but to put forward the recommendation I have.
Chair, we invite CAMS here, we invite all sorts of people here. I'm asking to invite the county council here and try and get something moving forward. If it's one meeting for 30 minutes where the county council explains how we fund it or how we don't fund it, you can block this today or ask me to do something stupid. And then when we get the big flood, whenever that happens, I've tried.
I'm not saying that flooding isn't an issue. It is. And, I'm sure you would be able to present some sort of academic study to tell me that flooding will only get worse. That may well be the case. But you're effectively asking us to endorse a multi-million-pound project without telling us how you're going to fund it. For what it's worth, I would be happy to invite the flooding team from Warwickshire County Council into this committee for a generic discussion about flooding-related issues across the borough, because I have specific issues from Bedworth that I would like to raise, and I'd be happy for that platform to be given here. But I have to say, I wouldn't be surprised if Warwickshire County Council turn it down, because it's not within the remit of this. I don't think it's in the remit of this panel. They would turn around and say, I think, would it fall into the community's OSC at Shire Hall? So we can put that request in, and as chair, I don't have an issue with that. I'm more than happy to add things into the work programme like that. But I wouldn't be surprised if the flooding team turn around and say, on what basis, and I'm not too sure what I'd say to them. But Councillor Kandaka.
I think inviting the flooding team will be here. I mean, you've got massive problems in Bedworth as well, with a different sort of geography. You've got flat, actual plain that floods. But they will need funding, and we actually are the planning authority. So I do think the discussion needs to have, and we are the climate change panel, and we never do any climate change stuff. So I think it would be a useful discussion to have as the next step.
Would the responsibility, if there was, would the flooding not come under the planning OSP? Because isn't if there were, so the planning department would be the statutory consultee on flooding related matters in the borough, so it would go to the planning OSP, wouldn't it? So I need.
Maybe it's just a question we need to ask all three and just say, where does this sit, whose responsibility? Because even if Warwickshire County, and maybe if Warwickshire County Council say no, they're not going to be prepared to come and talk to us, then actually what we need to say as well, as representatives of the borough, we just need to know, we need to feel confident that we've brought it forward as representatives to say there is, we feel that there is going to be an issue. Then if they rebut it back to come up with whether it's financial or what have you, then maybe then at least the borough can feel and have done what we can do for our residents. So at a later date, we've tried, because I think, no.
That's the. Can I just have 2 minutes just to go through the remit of the planning OSP? I apologise. and I have to go into the full council of May to look at the cabinet portfolio terms of reference. And go on. Well, that doesn't help. So, I mean, land drainage, so that would go to finance and public services. Yeah, again, look, at the end of the day, this comes down to money. And I'd be prepared to consider it if I can see the way forward to fund the project. And I'm not going to sit here and say flooding isn't important. It is. But these projects, if coming to fruition, I need to see where the money is coming from in order to proceed with it. Now, I'm happy for the council to ask Warwickshire Flooding if they would come to one of our OSPs. If it falls under the remit of this panel, I'm happy for it to be added to the work programme. And I think we would unanimously agree with that. If it falls into the remit of planning or the public services OSP, it goes into that. So if that can be taken away, I'd be grateful. However, there is a recommendation that's being proposed, it's being seconded, and I think we need to put that recommendation to a vote. So can I see all those who are in favour of the recommendation that I have proposed?
Can you read that from again? Sorry.
Yeah, so I can.
Sorry, that's my
Sure, I
fault,
can.
not holding
I
it.
can put it, yeah, sure. So the recommendation is as follows. The panel resolves to invite the leader of the Green Group to present a capital programme during the February 2024 budget setting process, detailing how such a project could come to fruition, taking into account the Council's medium-term financial strategy. The panel will review the scrutiny suggestion form upon receipt of this information. And that was seconded by Councillor Harbison. So that is the recommendation. It's been seconded, and I'm now going to put that to a vote. One quick question, and then I'm putting it to a vote.
Do I get capital officer time to check my proposal? Because obviously it needs to be signed off by the Section 151 officer. And do I, yeah, that's the main thing. Do I get officer time to make sure it's...
Any councillor is entitled to submit an amendment to the capital programme as presented at February full council. So,
Kyle, we never have any officer time to put forward any sensible suggestions.
Well,
because your group ties up the officers.
For someone who claims to be a financial expert, you shouldn't have much difficulty in presenting a capital programme. Because you claim to be an expert in these matters, Councillor Kandaka. So I'm putting this to a... I would have preferred it if you could have brought the information forward tonight, but I'm giving you 3 months to do it, and then we will review at our OSP after February. So the recommendation has been put, it's been proposed, it's been seconded. I'm going to the vote. All those in favour, please show. All those against, please show. So that's 3 for and 2 against. So the recommendation is carried. I'm now going to the next item on the agenda, which is the work programme as printed on page 149. Are there any comments that members would like to make on the work programme? I see no indication. So we will now go to item number 15, which is any other items. Councillor Kandaka, did you want to repeat your question on homelessness? Because I know that the Cabinet member probably wanted to provide a more comprehensive response with data, which she may now be in a position to do. Did you want to repeat your question for those who are watching from home?
Yeah, I just wanted basically an update on the number of people becoming homeless and the various places they're going to in terms of our accommodation and the bed and breakfasts. And also I had a question for Councillor Guttridge, if you remember, and he's now done a runner.
You didn't. No, you didn't, because no, actually you didn't. And I'm happy for people to go back on the recording. You just said there was one question left for Councillor Golby. And I know full well in Councillor Guttridge's character, if he knew there was another question, he would have waited. And there is a legitimate reason why Councillor Guttridge left the meeting early, which I was happy for him to do. So, Councillor Golby, are you in a position to answer the question around homelessness? Could you just repeat the question just so that it's on the record?
The question was, can we have an update on the current people becoming homeless, and how many are in B&B and how many are in our various bits of temporary accommodation?
I'm not going to break it down too much because we are, I don't want to give away who's staying where, because some people are there because of domestic abuse, etc., etc. So, yeah. So we've got 103 households in temporary accommodation at the moment. 3 of those have been decanted because of repairs to their homes, so are not actually homeless. We have, the breakdown is, out of that we've got 43 who are single families, so consisting of one person. We've got a total of 16 pets that we are currently looking after. Out of all the people who are currently in our properties, 20 have got offers of housing. We've got 85 void properties. Of that, 48 of them are ready to let. And in total, we only have 5 houses in bed and breakfast accommodation. The rest of it is being accommodated internally by the council.
Thank you very much, Councillor Golby. I just had one more item under any other items. So I think we need to get the ball rolling with respect to recruiting a new co-opted member for the panel. I think there's another vacancy on one of the other OSPs as well. So I'd like us to go out to recruitment, preferably before Christmas, to start that process so we can get someone in place early 2024. Ideally, I think it's got to be someone who has some sort of third sector experience. Perhaps they work for a housing association. They may be a volunteer at the Citizens Advice Bureau. But I'd like someone with experience in the community, with some sort of experience in what we discuss. Could I ask that the Democratic Services Department speak with HR about getting that process underway? And I think Wahida may have some involvement with that. So, yeah. Councillor Kandaka, is it on that point?
It is on that point. The independent people give us lots of value, particularly when they've got experience in the field. We've had in the past someone who's worked in the NHS finance, a different thing. But I just do want to say it's useful to have someone who's either retired or not working in something we actually fund. So, but they do bring a lot of value, asking those different questions. And thank you.
So that is it. So there's no more business to bring forward to the committee. So I announce the meeting closed at 28 minutes past 8. Thank you very much.